For number 16, John and his partner have been trying to conceive for over a year without success. He recently visited a doctor who suspects a fertility issue on his side. John is concerned about the potential causes. Which of the following could be most likely cause of John's infertility? So letter A, John's sperm may be perfectly healthy, but he and his partner are both under a lot of psychological stress. Letter B, John's sperm count is normal, but his partner has black fallopian tube. Letter C, John's sperm production may be too low, or his sperm may not be able to swim well enough to reach the cervix. And letter D, John's infertility is unrelated to sperm production but likely due to hormonal imbalance in his partner. So the correct answer here is letter C. Letter A is incorrect because yung psychological stress can be a factor in fertility issues, but it doesn't indicate that it is the primary cause ng male infertility ni yung infertility ni John. And for letter B, yung black fallopian tube are a cause of female infertility, preventing yung ova from reaching the uterus. But yung question is nakafocus sa male infertility issue ni John, so hindi sa partner niya. And for letter C, the correct answer, the most common cause of male infertility is low sperm production, or sperm may be unable to swim well enough to reach the cervix. So this directly aligns with the issue John is facing, making this the most likely cause of his infertility based on the information provided. And for letter D, yung question nga is nakafocus sa problem ni John's sperm, like yung low sperm count nga, and hindi sa partner niya. While yung hormonal imbalance in woman can cause infertility, the problem here is most likely related to John's sperm, not his partner hormones.
Number 17, an 83-year-old woman named Lola Crising has recently been forgetting the names of her grandchildren, gets lost in her own neighborhood, and has begun to struggle with basic daily tasks such as bathing and eating. Her family also notices that she occasionally becomes confused about the time of day and claims to see people who are not there. Over time, her condition worsens and she becomes bedridden, unable to communicate or recognize her loved ones. Based on this scenario, which condition best explains Lola Crising's symptoms and progressive decline? Letter A, Parkinson's disease, B, vascular dementia, C, delirium, and D, Alzheimer's disease. The correct answer is letter D. Alzheimer's is a brain disease that starts slowly and gets worse over time. The main problem is memory loss, especially forgetting recent events. People also have trouble thinking, speaking, and doing daily tasks. It cannot be cured and gets worse gradually. Lola Crising have the signs for this. Thus, Alzheimer's disease is the correct answer. Letter A, Parkinson's disease, is incorrect because Parkinson's is a brain disorder that affects body movement. Commonly, symptoms include shaking or tremors, slow movement, stiff muscles, and balance problems. It gets worse over time and has no cure, but there are medicines to help manage the symptoms. Unlike Alzheimer's, Parkinson's does not start with memory loss but mainly affects the movement. Letter B, vascular dementia, is also incorrect because vascular dementia happens when there is a problem with blood flow to the brain, like after a stroke. It causes problems with thinking, planning, and solving problems. Memory loss may happen, but it is not the main issue, and the symptoms can appear suddenly and may stay the same or get worse in steps. Letter C, delirium, is also incorrect because delirium is a sudden change in a person's thinking and awareness. It can make someone confused, have trouble focusing, or see things that are not real. It usually happens because of an illness. infection, or medicine. Delirium is not permanent and often goes away when the cause is treated. Number 18. An 81-year-old retired teacher, Mr. Santiago, recently stopped attending community meetings and declined invitations to family gatherings. While his health remains stable and he reports no symptoms of depression or anxiety, he expresses contentment in spending time alone, reflecting on his life and gradually reducing social commitments. His family is concerned about his isolation, but a developmental psychologist argues that this behavior is part of a natural and healthy process of aging. Which theoretical perspective best explains Mr. Santiago's behavior? Letter A. Activity theory. B. Continuity theory. C. Disengagement theory. And letter D. Socio-emotional selectivity theory. The correct answer is disengagement theory. Disengagement theory is when people get older, they slowly pull away from social roles and relationships. It's like a mutual process wherein older adults withdraw and society also gives them space, and this is seen as a normal part of aging. That is why this is the correct answer. Letter A, activity theory, is incorrect because this is the opposite of disengagement. It says older adults are happier and healthier if they stay active, talking to others, doing hobbies, or joining activities. Staying involved helps them feel more satisfied in life. Thus, this is incorrect because Mr. Santiago is doing the opposite, wherein he reduces activity and social involvement. Letter B, continuity theory, is also incorrect because this theory says older adults want to keep doing what they've always done. They keep the same routines, values, and relationships to feel stable and happy. Instead of changing, they continue the same lifestyle even in old age. Last, letter D, socio-emotional selectivity theory, is also incorrect because this theory explains that older adults focus more on meaningful relationships. They may have fewer friends, but those they keep are close and emotionally supportive. The goal is not to disconnect, but to spend time with people who truly matter. While Mr. Santiago doesn't show that he prioritizes emotionally meaningful relationships. That's why it's incorrect.
Number 19. Mrs. Davis, 92, is in the final stage of Alzheimer's disease. She is unresponsive on a ventilator and receiving artificial nutrition through a feeding tube. Her family, after much deliberation and consultation with her physician, requests that the ventilator and feeding tube be removed. They believe this is consistent with Mrs. Davis' previously expressed wishes to avoid prolonged suffering and artificial life support. This action would be considered letter A, active euthanasia or mercy killing. Letter B, passive euthanasia. Letter C, assisted suicide. Letter D, only legal with a durable power of attorney. And the correct answer here is letter B, passive euthanasia, because this involves withholding or discontinuing treatment that might extend life of a terminally ill patient, such as medication, yung mga life support systems, or yung feeding tubes, like dun sa tawag dito, like kay Mrs. Davis. And it is that this is also generally legal. So the scenario directly describes that the family is requesting the removal of life support, yung ventilator and feeding tube ni Mrs. Davis. And this aligns perfectly with the definition of passive euthanasia. And for letter A, hindi siya yung sagot kasi yung active euthanasia or yung mercy killing involves action taken directly or deliberately to shorten a life, and it is generally illegal. And removing life supports, while it may hasten death, it is not direct action to kill the patient. So the intention is to allow the natural process of death to occur without artificial intervention. And for letter C, yung assisted suicide involves yung physician or someone else na tutulong, helps a person bring about a self-inflicted death. And in this scenario, yung kay Mrs. Davis is unresponsive and unable to participate in any decision making or yung action to end her life. So the family is not assisting her in suicide, rather they are requesting the removal of life support. And for letter D, yung durable power of attorney appoints someone to make decision if the patients become incompetent. While this can be helpful in situation like Mrs. Davis, it is not strictly required for the legality of passive euthanasia. So the family requests even without a durable power of attorney, and pwede pa rin siyang makonsider as a valid expression of the patient's presumed wishes based sa knowledge or sa preferences, especially sa support ng mga medical professionals. Number 20, life review therapy uses various methods to help individuals reflect on their lives and achieve a sense of closure. Which of the following is not explicitly a method often used for uncovering memories during life review therapy? Letter A, record an autobiography. Letter B, conducting an interview. Letter C, examining photo albums. Letter D, spending time with a scrapbook. So the correct answer here is conducting an interview. Letter A, mali siya kasi yung autobiography is a method na ginagamit in life review therapy to uncover yung mga memories. And letter B, the correct answer, yung conducting an interview could be helpful. Helpful siya as a tool to elicit memories pero hindi siya isang method. And for letter C, spending time with scrapbooks, photo albums, old letters, and other memorabilia are methods used in life review therapy. And for letter D, yun nga nasabi kanina, with photo albums, this is also used to facilitate memory recall during life review therapy.